Hello and welcome. My name is Calliope and I'm the nurse that's going to be performing your assessment today. How are you doing today? Okay. Well, I hope by the time you leave this office you feel even just the littlest bit better. Alright? Okay, so let me see what we've got going on. So the head to toe assessment. So for our head to toe assessment, we're going to be quite literally working from the tip of your head all the way to your toes, working down your body, inspecting, palpating, what have you, to make sure that there isn't anything out of the ordinary. All right? Okay. So, could I please just get your name and date of birth? Okay. Very good. All right. And is that your preferred name? And how do you like to be addressed? Okay. Very good. So, for this examination, I'm going to need to be touching you. Is that all right with you? Do I have your permission to do that? Okay, very good. So, I'd like to do just a very short neurological assessment with you, okay? So, it already started a little bit when I asked you your identifying questions, right? So, where are you right now? Okay, very good. And what are we doing? Yes, head to toe assessment. Good. And who's the current president? Okay, so you are oriented to current events and place and what we're doing. That's very good. So now I'd like to get some vitals from you, okay? So let me see. We're going to start off by taking your temperature. Okay, so if you could just open your mouth for me. Okay, and lift your tongue to the roof of your mouth. I'm just going to pop that in your mouth, and if you can let your tongue rest on top of this. We'll wait a few moments. And very good. So I'm just going to pull this out of your mouth. Okay, and you can close your mouth. Very good. Just going to note that down. Very good. Now let's go ahead and take your pulse and your respirations, all right? So do you have any preference as to which side I take your pulse from? Okay, I'm just going to start here. And I'm just going to be counting your heartbeat. Okay, very good. Okay, and respirations are also within normal limits. Okay, so I'm gonna grab your blood pressure real quick, okay? It'll take me a moment to get all my bits and bobs. a handy dandy sphygmomanometer here. I'm just going to place this down and pop in my stethoscope. It's a bit of a coordination effort when doing this. So I'm just going to take that same arm that I checked your pulse with, okay? And I'm going to wrap the cuff around your arm firmly. Okay, and I'm going to run that tubing down your radial artery essentially. And I've got the dial in one hand and I'm just going to inflate the cuff. It will get quite firm, just so you know, okay? Okay, and I'm going to let the air out. Okay, and we're going to do that one more time. And let the air out. Okay, very good. So, just gonna let that deflate, and then we're gonna take it off. Okay, very good. Right. So, I don't need the stethoscope anymore for the moment, so I'm just going to pop that around my neck. Okay, so that was about 130/70 millimeters of mercury. Very good. Lastly, I want to check your oxygen saturation rate, okay? So I've got a little clip I'm just going to pop on your finger. Alright, you just hold out your finger for me. Okay, and I'm just going to clip that on. And I'll have you just rest your arm. And we'll wait a little bit. Alright, let's go ahead and check that. Alright, very good. Okay, so I'm just going to take that off your finger. Very good. Alrighty, and that is well within normal limits. Okay, next, do you have absolutely any pain in your body on a scale from 0 to 10, with 0 being absolutely no pain at all, and 10 being the worst pain you've ever experienced? Okay, very good. Alright, so now we're going to move on to the actual process, alright? As I said before, we're going to start at your head and move down your body. First, I'd like to take just a general inspection of you. I'm going to take a step back and I'm going to look at you as a whole so that I know to note down any particular concerns I have, things I need to look for in depth when I get to it, okay? Alright, so taking a step back and just looking at you as a whole. Very good. Very good. Very good. Okay. That looks great. So I'm just going to note that down. Right. Very good. Okay. So now we're going to go into the head. We're going to do a little bit of inspecting, a little bit of palpation, Okay, we're gonna look at your eyes, your nose, your mouth, your ears, your neck, okay? So first, let's just go ahead and take a little look, all right? So I'm just going to look around you here, okay? Not doing any palpation just yet. Just want to have a little peek around you. Okay, and now we're going to go ahead and test cranial nerve number 7, okay? So this has to do with your facial movement. So if you could close your eyes real tight for me. Good. And can you raise your eyebrows? Good. Can you puff out your cheeks? Very good. Can you smile for me with your teeth? Good. And can you frown for me? Okay, very good. Very good. So now we're going to move into some palpation. I'm going to be palpating primarily your scalp. So I'm going to put some gloves on real quick, okay? Alright, these won't be on for the entirety of our examination, but I do like to put them on when we are looking at your head, your scalp, and also your mouth. Alright, there we go. Okay, gloves are on. So now we're going to take a look at your scalp. Okay, now I'm just going to be feeling around. I'm going to be both inspecting and palpating around your scalp. Have you had any issues with your scalp or your hair at all? Any sudden dryness or oiliness, flaking, or patches of hair loss? Any tender spots? Anything irritated? Okay. And no swelling? Very good. Do you get frequent headaches at all? Okay. Alright, that looks good. So now I'm going to be palpating your temporal artery right here, okay, on both sides. And I'm just gonna feel those for just a moment. Okay, very good. And now I'm going to test a little bit of the muscle strength in your face. So first I'm going to feel around the TMJ joint, the masseter muscle, okay? And I'm gonna have you clench your teeth for me. Okay, can you open your mouth for me? And close, open, and close. Good. Now I'm going to do that again, but this time I'm going to feel the temporalis muscle. If you could clench your teeth. Good. And open your mouth. Close your mouth. Good. Open. And close. That's great. Okay. Just going to take a moment to take some notes. Alrighty, let's see. Very good. Alright, so I'm going to go ahead and just pop my gloves off real quick. We won't need them for a little bit. Okay, and I'm just going to sanitize my hands real quick. just get rid of any sweatiness or any nastiness from wearing gloves. There we go. Very good. Alright, so very good. Okay, so now we're going to test a little bit of the muscle strength again. So I'm going to have you keep your mouth shut for me, okay? And I'm just going to put my hands under your chin, and I want you to open your mouth against my resistance, okay? Alright, so just open your mouth. Very good. That looks great. And then we're going to do a little final palpation. First, I'm going to just palpate the TMJ joint a bit. Okay. Do you ever have any troubles with your TMJ joint? Any soreness? Okay. Sometimes people find that they clench their jaw a lot, they grind their teeth, and it can give them headaches. It can do all sorts of things to your teeth. It can lead to a lot of soreness. That's why I ask. Okay, and let's go ahead and look at your sinuses, okay? So I'm just going to be tapping along your maxillary and your frontal sinuses. I want you to let me know if there's any pain or tenderness, okay? Alright, so maxillary. Just tap, tap, tapping all along there. Any pain or tenderness? Okay. And the frontal. Tap, 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 tap. Any pain, any tenderness? Okay, very good. Alright, and we are going to be moving on to your eyes, alright? We're going to do a little inspection, and then we're going to do a few different tests, alright? So, just want you to look straight ahead for me. And I'm just going to come in real close, and I'm just going to look at the structure of the eye. Making sure that your eyebrows are intact, your eyelashes are intact. Making sure there aren't any color changes or swelling, drooping, things of that sort. Your eyes look clear, alert, and I want to look. I'm going to pull your eyelids down and I'm going to have you look up. I'm going to look at the conjunctiva. So I'm just going to pull down, look up. Good. And then I'm going to pull up and you'll look down. Pull up, look down. Good. Those tissues look nice and pink. There's no inflammation. Okay. So now we're going to move on to a few different cranial nerve tests. We're going to be doing number 3, 4, and 6 with this. So first, I want you to look at this pen light, okay? So I'm going to be having you follow this using only your eyes without moving your head, okay? So if you could just follow the tip of this pen light for me. Very good. Very good. Looking for any delay, any skipping, any nystagmus, any movement that shouldn't be there or that isn't working quite so smoothly. Very good. Great. Okay. Good, 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 good. Good. Okay. excellent. So now I'm going to be testing your pupil's reaction to light, okay? I'm going to have you look into the distance behind me, okay? And I'm just going to shine a light into your eye, all right? So just keep looking behind me. Okay, keep looking behind me. Okay. We're going to do that to the other side, so if you could look behind me. Good. Okay, and keep looking behind me. Excellent. So now we're going to test your accommodation reflex, okay? I'm going to have you look behind me, okay? And then if you could look at the tip of this pen, I'm going to bring it in. I want you to follow it using only your eyes without moving your head. Okay? Very good. Look behind me. Now look at this pen. Follow the pen. Good. Okay. Look behind me on this side. And look at this pen. And follow the movement. Very good. Look behind me. Look at this pen. And go in. Very good. Okay, that's excellent. So the reason I have you look behind me is that makes your eyes dilate, so then I can really see them constrict when we're doing the accommodation reflex, when we're looking at them with the light, okay? All right, we are just chugging along, aren't we? You doing okay? All right, let me know if at any point you need to take a little break, okay? We're gonna go ahead and move on to your ears now. Do you have any pain or discomfort in either of your ears? Okay, very good. All right, so we're going to do some inspection, some palpation. We're gonna take a look at the inside, okay? I'm just gonna look at one ear at a time, firstly, okay? I'm going to start with this ear. Just come to the side and want to have just a little look here. And I'm just going to be palpating along the ear. Please let me know if there is any pain or any tenderness. Okay. Just feeling along the helix. Down to the lobe. Okay. Now press into the tragus. Any pain or discomfort there? Okay, I'm going to take a look behind your ear. Behind right ear. Okay. Alright, very good. And then I'm just going to have a look at the other ear. So no pain or discomfort? Okay, that's very good. So now just going to pop a speculum onto the otoscope, and we're going to take a look inside your ear, okay? I'm going to flip on the light. Let's see. There we go. And I'm just going to take a little peek. I'm going to lift your ear up and back. And I'm just going to be inserting the otoscope into the ear canal. And having a little look at the tympanic membrane and the external auditory meatus. Just making sure that there isn't any swelling, any infection, any perforation. The tympanic membrane is a pearly gray color. We can see the cone of light. Okay. I also want to make sure that there is no obstruction of the ear canal. Okay. I'm just going to pull the otoscope out. And put your ear back. Very good. I'm going to do that to the other side. Just going to pull the ear up and back and gently insert the otoscope into the ear canal. Okay, so same thing over here. I just want to make sure that the ear canal looks clear. The skin is healthy. Tympanic membrane is intact. Okay. And it all looks good from here. Okay. Just gonna pull out the otoscope and put your ear back. Okay. That looks really great. Right. And next, we're going to test cranial nerve number 8, and we're going to do a little whisper test. So I'm going to cover one ear, and I'm going to whisper into the other ear, and I want you to just tell me what it is that you heard, okay? So I'm going to cover one ear. Coconut. Pineapple. Lemon. Okay, and what were those words? Coconut, pineapple, and lemon. Very good. I'm going to cover the other ear. Pear, cherry, peach. And what were those words? Yes, pear, cherry, and peach. Can you tell I'm thinking about fruit? Yeah. It's been a long time since I've had such a food. All right, so now we're going to be moving on to your nose. Have you had any sort of issues with your nose? Any drip, any pain, stuffiness, anything like that? Okay, I'm just gonna have a little look. Just a little look here. And then we'll bring out a little light to take a look at your nose on the inside. Okay, let's see. Just gonna use my pen light, I think. So I'm gonna have you tip your head back for me. I'm gonna take a peek inside your nose real quick. Okay, the septum is intact. Have a good amount of little hairs, which is good. You need those. Okay, and the passages look clear, and skin looks nice and healthy. It's very good. So now we're going to test cranial nerve number 1 with a little smell test, okay? I'm going to have you close your eyes. Right, and I'm going to have you smell this little jar, okay? Take a little smell. And what does that smell like? Peppermint. Very good. Okay. And even though I didn't see any blockage in either of your nostrils, I want to make sure that you can breathe out of each one individually. So if you could just cover one nostril and take a few breaths for me, okay? So just cover this one, take a few breaths. Good. And then the other, just take a few breaths. Good. Okay, that's great. Everything looks good with the nose. Okay, so now we're going to look at your mouth, and I'm going to put on my last pair of gloves, all right? Okay, we're going to do a little inspection, a little bit of palpation. So I'm just going to look at your lips, make sure there's not any sign of any cold sores, your lips aren't chapped, they're not turning dusky or bluish color, okay? The corners aren't inflamed in any way, irritated, I suppose I should say. Okay, and I'm going to have you stick out your tongue for me. We're going to do a little cranial nerve 12 test, okay? Stick out your tongue for me. And can you move it from side to side? And can you move it up and down? Very good. Okay, so that governs tongue movement. Go ahead and put your tongue inside your mouth. And we're going to do a little poking around in your mouth, okay? I'm going to have you open it up, okay? And I'm just going to use this little stick to move your tongue out of the way so that I can look inside of your mouth. Okay. Very good. I'm just going to pull your tongue down. Right. And another little cranial nerve test. If you could say ah for me. Good. Okay. And I'm just going to have you lift your tongue to the roof of your mouth. Very good. Okay. So I'm just going to look at your teeth a little bit, okay? So you could keep your mouth open. Won't be for much longer, all right? Okay, very good. When was the last time that you've had a dental examination? Okay, very good. All right, you can go ahead and close your mouth, and I'm going to take off the gloves now that they've been in your mouth. And I'm going to sanitize another time, okay? Fresh and clean. It also helps that sanitizer smells quite pleasant. It smells like a fresh, clean day. There we go. Oh, let's see here. Okay. Alright, and one last little cranial nerve test. If you could just swallow for me. Okay, and any trouble with that at all? No? Okay. So we tested cranial nerves number 12, 9, and 10 with your mouth. Okay, so we're going to do a little inspection on the neck now. We're moving away from the face. The face tends to take most of the time, I think. So let's go ahead and take just a little look at the neck. Have you felt any swelling or masses at all? Okay, and there's been no pain or any sensation? Okay, very good. So we're gonna do another little cranial nerve test. I'm gonna have you move your head from side to side. Okay, any trouble with that? Good, and if you could go up and down. Good, any trouble with that? Okay, and if you could shrug your shoulders for me. Just lift them up and let them go. Okay, very good. So I'm just gonna note that down and then we're gonna go ahead and check on your lymph nodes. So I'm going to start at the preauricular lymph nodes here, okay, right in front of the ears. And then we're going to go to the postauricular. And back to the occipital. And forward to the parotid. And the jugulo-digastric rather. Okay, let's check the submental and submandibular. Okay, and then we're going to be doing the different cervical lymph nodes in the neck. Okay, and lastly, the supraclavicular. Very good. Okay, wasn't any swelling in any of your lymph nodes. Okay, and this is the part where we're going to be bringing the stethoscope in again. But first, I'd like to palpate your carotid artery. We're going to do one at a time. Okay, so it might be a little uncomfortable, okay? So I'm just going to be feeling that carotid. Okay, and the other. Comparing them, making sure they both feel as they should. And then I'm going to bring the stethoscope out. And we're going to auscultate them and listen for any bruits. All right, so if you could take a deep breath for me and hold it. Okay, go ahead and exhale. All right, and take another deep breath for me. Hold it. Okay, and you can exhale. Right, very good. Alrighty, so now we're going to move into your upper extremities. Alright, we're going to do some inspection, some palpation, okay? So I'm just going to look at your arms, your shoulders, your hands. Do you have any problems with any pain, any movement restriction, any skin changes, anything to do with your upper extremities? Okay, very good. All right, so I'm just going to start by palpating both of your radial pulses right in here bilaterally at the same time. Okay? Just make sure that they match, essentially. Same strength. Okay, very good. And if I could check your capillary refill real quick, I'm just going to be pressing onto your fingernail, releasing and watching the blood flow come back, okay? I'm just going to be working with each of your fingers. Good. Okay, and I'm going to be feeling your fingers and your joints. Let me know if there's any pain or any tenderness, okay? I might be moving them around as well. I want to make sure that they are moving as they should. There's not any swelling. Okay, and if you could just rotate your wrists around for me. Very good. And I'm just going to go ahead and palpate your brachial pulses bilaterally. So that's in the crook of your elbow. Okay? All right. Okay, very good. Just going to note what we've done so far. Okay. All right, and if you could squeeze my fingers like that as hard as you can. Okay, very good. And I'm going to have you hold your arms up for me. I'm going to try to push you. I want you to push against my, or resist against me, okay? I'm going to push. Okay, and now I'm going to pull you towards me. I want you to resist me. Very good. Now I'm just going to be taking your arm and rotating it a little bit. Is there any pain in any of this? Okay, and the other arm. Any pain in any of this? Okay, very good. All right, now we're going to be doing a little bit of a weird test. So I'm going to have you hold your arms up at a 90-degree angle to your body, right? So parallel to the floor. I'm going to have you close your eyes, okay? I'm just going to watch your arms. Okay, you can go ahead and put them down. The reason we do that test is some people, like people who've had a stroke before, you find that maybe when they close their eyes, one arm starts to drift upwards, so we're looking for a drift, okay? All right, so now we're going to be moving in to the chest, all right? Primarily that's heart and lung sounds, really. So I'm just going to take a real quick peek, all right? Just going to look at you here, and then we'll do a little bit of auscultation. Okay, yeah, I think that's just fine. There's not any signs of any scars or any chest deformities. Okay, now we're going to be listening to your heart, okay? I want you to just breathe normally for me, okay? So first, we're going to listen to the aortic valve. Okay, and the pulmonary. and Herb's Point. And the tricuspid. And the mitral. Okay, very good. All right, I'm going to note that down because we're going to be moving on to the lungs. All right. So I'm going to listen to the front of your lungs, and then we're going to take a little detour. I'll be moving to your back, and I'll be doing a little bit of an inspection, and then I'll finish listening to your lungs, okay? Alrighty, so I'm going to have you take a deep breath when I ask you to, okay? So go ahead and take a deep breath in. And out. 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 And finally, I'm going to have you lift your elbow up a little bit. Okay, deep breath in. And out. Other side, lift your elbow up a bit. Good. Deep breath in. And out. Perfect. Okay. So, as I said before, I'm going to pop around to look at your back, and then we're going to finish that auscultation. Okay? Alright, so just going to be looking behind you, looking at your back, again, looking for any deformities in the chest wall, any scars that might show signs of any previous surgery. And in addition to that, I'm looking at the skin of the back. I'm looking for any wounds, any signs of inflammation, irritation, any swelling. I'm just going to feel your sacrum real quick. Okay, looking for any edema here. Okay, and looking for any moles, any skin markers that are out of the ordinary. Okay, so now I'm going to pop in my stethoscope again, and we are going to take a listen to your back. So again, I'm going to have you take a deep breath when I ask you to, okay? All right, deep breath in and out. 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 Finally, deep breath in and out. Okay, just going to be coming around to the front. And now I'm going to be having you lay down on the table, okay? Because we're going to do our abdominal examination. Okay, very good. So first we're going to do our inspection. And I'm looking for any masses or pulsations. Okay. And then we're going to start with our auscultation. We're going to start in the right lower quadrant. And we're going to work clockwise, okay? We're going to listen to the sounds of your inner organs and just work our way around your abdomen. Okay? And we're going to do some palpation. We're going to first start with a light pressure, and then I'm going to be doing a deep pressure, okay? That deep pressure might be a little uncomfortable. I just want you to try to breathe through it. It's not very long at all, okay? We're going to start with the light pressure in the right lower quadrant. Move up to the right upper. And the left upper. And the left lower. Okay, and now we're going to be doing that deep pressure. Just breathe through it. So right lower. Right upper. And left upper. Left lower. Okay, so was there any sort of pain or tenderness at all? Okay. Very good. All right, so now we're going to move on to the lower extremities. So I might be a little bit out of view while I'm looking at your legs and whatnot. So we're going to do a little inspection. We're going to check on your pulses, do a little palpation, okay? All right, we're almost done, I promise. So, have you had any problems with your legs at all? With any pain in any of the muscles, the joints, anything uncharacteristic for you? Okay. All right, and I'm just going to be feeling some of your pulses here. So I'm going to feel behind your knees. It's the popliteal. Okay. And while I'm moving down, I'm just going to press into your tibia. We're going to look for any signs of pitting edema. And down to your post-tib pulse. Okay. And there's a pulse right on the top of your foot here. And I'm going to feel around your ankles real quick. See if there's any swelling. Okay, so I'm going to check your toes for capillary refill like we did on your fingers. Okay. All right, I'm just going to move your toes around a little bit. Let me know if there's any pain. Okay, very good. And I'm going to press your toes down. I want you to try to resist me, okay? All right, I'm going to try to pull up. I want you to resist me. Okay, very good. And I'm just going to look at the bottoms of your feet here. Okay, good. All right, and I'm just going to put my hands on top of your legs. I want you to raise them against my resistance. Okay, very good. Now, lastly, we're going to check Babinski's reflex. So I'm just going to be stroking this up your feet and making sure that we get the right reaction, okay? All right, so we're just going to roll that up the foot. Very good. And the other foot. Roll that up. Good. So usually people have their toes curl inward. Babies, it's a little different, but adults, it's generally the same as long as there isn't an issue. And there wasn't with you. So that concludes our examination today. Do you have any sort of questions, any concerns for me at all? Okay. All right, so that is a perfect head-to-toe assessment. I'm quite pleased with that. So if you don't have any further concerns, I'm going to go ahead and sign off. Very good. Okay, so put that down. All right, so thank you so much for coming into the office today and getting this head-to-toe assessment by me. I really appreciate it. I hope that you have a whale of a day and a good rest of your night. Thank you. Goodbye now.